So good afternoon and welcome to this celebration of Universal Health Day 2021, organized by the Pan American Health Organization. My name is James Fitzgerald. I'm the Director of the Department of Health Systems and Services, and I'll be your moderator for our event today. In addition to those connected via Zoom, we welcome also those participating via YouTube and Bolivia TV. In 2014, PAHO member states adopted the regional strategy on universal access to health and universal health coverage to ensure that everyone, everywhere, will have access to comprehensive, integrated, quality health services without incurring financial hardship. Given the importance of this overarching mandate for PAHO, we celebrate Universal Health Day every year at this time of year. Today's event is a culmination of a series of events we've organized this week. We are truly honored to have with us today the President of the Plurinational State of Bolivia, His Excellency, Luis Alberto Arce Catacora, the Director of the Pan American Health Organization, Carissa Etienne, and the Assistant Director of PAHO, Jarbas Barbosa. And so let's begin. It's with great pleasure that I hand over now to our Director, Dr. Etienne, to formally open our event.
Thank you, Dr. Fitzgerald. Excellency, Mr. Luis Alberto Arce Catacora, President, Plurinational State of Bolivia, Minister of Health of Bolivia, Ministers of Health, ambassadors to the Organization of American States, health professionals, academia, civil society representatives. Ladies and gentlemen, thank you for joining PAHO today to observe the Universal Health Day 2021. In October 2018, at the historic Global Conference on Primary Health Care held in Astana, Kazakhstan, the world reaffirmed the commitment to the values and principles of primary health care in the spirit of the Declaration of Alma-Ata. We reaffirmed that health is not a privilege nor a commodity. It is a fundamental human right. 1 year later, world leaders approved the UN Political Declaration on Universal Health Coverage. And it was described by the UN Secretary General as, and let me quote, the most comprehensive agreement ever reached on global health, a vision for universal health coverage by 2030, and an important landmark on our journey for health for all. At the center of these new important milestones in public health is the recognition of primary health care as an approach and a strategy for health and well-being, for human and social development, which is centered on the individuals, their families, and the communities. It is not merely the first level of care, nor is it the provision of a limited package of services for the poor. Primary health care calls for universal access to quality, comprehensive health services, not only curative, but also for promotion, prevention, rehabilitation, palliation, and treatment of common conditions. It calls for addressing the social determinants of health. Primary health care must form a central part of the strategy for transforming health systems to achieve universal access to health and universal health coverage. It must guide investments in health. Leaving no one's health behind, investing in health systems for all is the theme for the Universal Health Day 2021. And it is only achievable through a primary healthcare approach. We have been saying this for over 40 years now, since the adoption of the Alma-Ata Declaration in 1978. Honestly, much of what we have seen over the decades in health sector reform has been just the tweaking here and there of elements of the health system. I dare say that we have not seen the scale of transformations that we require to ensure that we can provide care for all people, nor at the scale and capacity to improve preparedness and response during public health emergencies as well. The COVID-19 pandemic fundamentally exposed pre-pandemic weaknesses of our health systems, as well as limitations of existing global regulations in health. There is resounding recognition of the urgent need to advance in the substantive transformation of health systems and their governance, now more than ever, to recover and recuperate lost public health gains, and to be better prepared for future public health emergencies and pandemics. Resilience is an attribute of a well-performing health system in times of emergencies and beyond, and must be central to the transformation of our health systems in the future. Experience during the pandemic has made it clear that investing to build resilience in health systems is imperative to protect and promote health, as well as to sustain social and economic development. PAHO will support actions of member states to accelerate the recuperation and protection of the lost public health gains, and to advance transformation towards more resilient, sustainable, and inclusive health systems during what may be a complex and protracted social and economic crisis in the Americas. Many countries have historically prioritized investments in tertiary hospital-based care, which has been important in tackling the COVID-19 pandemic. In some countries, hospital bed capacity has doubled in a period of less than 2 years. This investment is well merited and has saved countries countless lives throughout the Americas. Notwithstanding, hospitals alone, without a strong first level of care, do not address the integral and holistic needs in health of the population. In the most recent PAHO survey, 46% of countries in the region continue to report significant disruptions in health service delivery, impacting mother and child care, the control and management of communicable diseases, routine immunization, and non-communicable diseases control and prevention. Although the data is still limited, excess mortality and morbidity is rising. So as we look to the future, we must be better prepared. We must address pre-pandemic systemic deficiencies as a matter of priority, including the underinvestment in health and health systems throughout the region. And we must sustain the political will and investments that are so necessary to build resilient, equitable, and inclusive health systems based on primary health care. Primary health care provides us with the platform to deliver quality, comprehensive care to all, consistent with the principles of universal health. And it strengthens the essential public health functions, ensuring effective articulation between the needs of the individual with those of the community and the population as a whole. Transforming health systems based on primary health care augments our capacity to identify and respond to epidemics, crises, and emergencies, addressing health needs in such times and beyond. To this end, we need adequate financing to sustain and expand access and coverage, to organize and reorganize health services networks, ensuring the expansion within cities and rural areas alike, ensuring continuity and quality of care for all. We need a well-distributed, qualified, and motivated healthcare workforce, not solely concentrated on hospital specialists, but one that takes into consideration the comprehensive competency needs at the primary care level, including community healthcare workers. Primary healthcare needs to go beyond just the words. We have to increase the capacity of services at the first level of care to address the health conditions of people within the community, And such services must be available within the community where people live. We need information systems that generate data for decision-making, disaggregated and supporting decision-making. The transformation of our health systems can be driven by digital transformation in health, bringing to bear the power of technology to improve the health of all. We need access to health technologies, medicines, diagnostics, vaccines, and medical equipment. Increasing the capacity of the region of the Americas in research and development, in production capacity of essential medical products, simplifying supply chains, and promoting greater integration in science, technology, industry, and health. And we must invest in our people, in our health and in our health systems. This means increasing public expenditure in health to at least 6% of the GDP, allocating at least 30% of this expenditure to the first level of care, under a transformation agenda that is based on the primary healthcare approach. The COVID-19 pandemic has cost the lives of more than 2.3 million people in the region and has impacted the lives and livelihoods of us all. As we continue to tackle COVID-19 and increase vaccination coverage throughout the region, we must sustain our interventions and intensify our actions, building the health systems of the future. This will allow us to be better prepared in the face of future pandemics. So on this occasion of Universal Health Day 2021, let me urge us all to act decisively and to act at scale. We need to be bold if we are to recover lost public health gains and retake the path towards the achievement of universal health in the Americas. And we must act now to build resilient health systems. The strategy for building resilient health systems, unanimously approved by PAHO member states in September of 2021, provides a roadmap looking forward, incorporating lessons learned from the pandemic. It calls for the transformation of health systems based on primary health care, the strengthening and expansion of integrated healthcare delivery based on a strong first level of care, and the integration of the essential public health functions to build the necessary capacities to address health needs. It also importantly calls for renewed focus on the stewardship and governance of our health systems and investments in health systems, and social protection in health. I want to reassure you that PAHO remains committed to supporting our member states in their efforts to transform health systems to this end. Such transformation is not only possible, but it is the right thing to do and the smart thing to do. It is only possible with a clear vision at the country level, political commitment at the highest level, strong leadership at the national health authorities, and importantly, community engagement. I am positive that His Excellency, Mr. Luis Alberto Arce Catacora, President of the Plurinational State of Bolivia, will provide us insight of what it takes to lead a transformative agenda of this type. Let us be bold and innovative as we look to the future. Let us make this unprecedented public health crisis an opportunity for transformation. Let us invest in health systems for all, leaving no one's health behind. Thank you so much.
Thank you very much, Dr. Etienne, for those wonderful remarks on this the occasion of the celebration of Universal Health Day 2021. I'd like to now hand over, voy a cambiar idioma.
Let me switch language. And once again, I invite the Minister of Health of Bolivia, Minister Arce, to share some remarks with him while we await the arrival of the President.
Muy buenas tardes a la doctora.
Good afternoon, Dr. Carissa Etienne. I would also like to greet all the ministers that have joined us at this very important meeting. And I also wish to inform you that our president has already reached the venue and in a few moments will be able to join us. Thank you for your remarks. And for all participants at this session, we ask you to be patient for a few more minutes while we await arrival of the president so that we may his words. His intervention at this 2021 Universal Health Day. So we will hear from the president in a few more moments.
Muy buenas tardes.
Good afternoon to each and every one of you at this very high-level meeting. Greetings from Bolivia. Warm greetings to James Fitzgerald, Director of the Health Services Department of PAHO. Warm greetings to Dr. Carissa Etienne, Director of the Pan American Health Organization. Let me also greet Jarvas Barbosa da Silva Jr., Assistant Director of the Pan American Health Organization. Greetings also to our Minister of Health, Jason Arauza, and all the Ministers of Health of member countries. Mrs. Alma Morales, PAHO WHO representative in Bolivia, and those who are listening to this transmission over the national networks and all the other media that are broadcasting this presentation. We're happy to be here. Good afternoon to you all. We are gathered here to celebrate the Universal Health Day in a complex health context globally that once again underscores the inequalities when talking about an intercultural, warm, and quality access to health services. The World Health Organization, with regards to the pandemic, has pointed out that it shows up the complex links between health, economy, the environment, and the social protection policies and mechanisms. As countries continue to tackle the pandemic and look towards recovery, public health advances that occurred over the past 10 years are slipping away and backsliding, as well as the achievements that have been obtained in the development goals and universal health care. And this must draw our attention, must call us to action through a non-commercialized view of health. In the Plurinational State of Bolivia, beginning in 2006, we have focused our economic and social, cultural, educational policies, as well as the health policies, to have a social inclusion and protecting the Bolivian population, especially the most vulnerable, working to ensure that nobody is left behind. We built a social economic model that is productive, alternate to the neoliberal model, focusing on economic growth with social justice, with income redistribution and a drop in poverty and inequality. This economic model made it possible for the size of our economy to move from $9.5 billion to $40.6 billion in 2019. Through this, we were able to increase total health investment twofold growth from $500 million to $1 billion. The impact of this major increase facilitated implementation of the single free health system. We call it by its acronym in Spanish, SUS, providing 60% of the population that is not covered by Social Security to have access to health care. And historically, this is a population that had been excluded. We reduced at an accelerated pace extreme poverty from 37% in 2006 to 12% in 2019. And inequality measured by Gini from 0.59 was brought down to 0.42. Together with Brazil and Bolivia in 2005 was the country that had the most unequal distribution. From 2006 to 2008, despite the international crisis, Bolivia was one of the countries with the best economic management, occupying position 1 in economic growth in the region over a 5-year period, consecutive years, actually. But even more important is the coordination between the economic and social aspects. Moreover, the family intercultural community healthcare, a program known by the acronym SAUCI, established in 2010 in our country, provides models for care based on integrality, intersectorality, community participation, and interculturality to promote health and the prevention of disease with a collective health focused on the person, the family, the community, and the environment, and recovering traditional and intercultural medicine. The 2,700 family health teams of Mi Salud was key in the actions to contain COVID-19. And currently, it is expanding its work to recovery of the essential healthcare services. Bolivia is the third country in the Americas that has met the target of the 30-30-30 Pact for universal health, as declared by the PAHO Director General. Bolivia assigns 38% of its public budget on health at the first level, to a large extent by having Mi Salud physicians and doctors. Thanks to these policies, we have reduced child mortality from 54 per thousand in 2003 to 24 live births in 2016. We have also reduced neonatal mortality rate per thousand live deaths in 24% in 2003 to 15% by 2016. In 2018, 27% of children approximately under 5 were in chronic malnutrition conditions. By 2016, that number was brought down to 16%, an 11 percentage points drop. These results were possible thanks to encouraging maternal breastfeeding, the fertilizing food, providing supplements with micronutrients that became possible through the zero malnutrition programs and school food programs implemented by our government. Unfortunately, since 2019, we have a constitutional interruption and an interruption of our constitutional life where the de facto government tried to leave our plurinational state behind. The neoliberal model was picked up and wanted to affect the health system, but the impact at first received was the pandemic was not properly addressed at the outset. The illegitimate government not being able to manage the health alert declared rigid quarantines and lockdowns, compliance of which to a large extent was put in the hands of the armed forces and national police. This was going against the human rights of our population. Once the Bolivian people recovered democracy at the ballot boxes, last year in October, we have once again started building the Plurinational State of Bolivia under the political horizon of living well, alternative to capitalism. And also we recovered the productive community model and our health policy focusing on universal care has been extremely important in order to address the problems.
Therefore, I would like to be very clear when mentioning a couple of issues that I believe are important and should be duly highlighted. The greater the solution capacity with the first level of care already integrated, the pandemic has shown what is essential, which is not having a robust, sound first level that will apply a primary health care strategy. Likewise, Bolivia has one of the health policies most identified with the APS in our SAPC program or model, and therefore we will dive into the implementation of this policy throughout the health system. Likewise, we will improve extensively the capacity to resolve the over 3,000 first level establishments, as well as the 104 integrated networks that we have in the country. That will be the basis that will avoid the collapse of hospitals when dealing with emergencies in the situation with the COVID-19 pandemic, but essentially will allow the entire population to have a rapid and effective access to the whole set of essential care measures, participation in social mobilization. As is stipulated in the SAPC policy, social participation is the substantial element for a resilient health system, beginning with the election of local health authorities, having communal plans, the participation in the allocation of resources, and consolidating this in social control. At the international level, we are some of the countries that have led the world campaign for the release of vaccines. We support the proposal of India and South Africa to exempt certain provisions of the agreement on outbreak through the reserve of outbreaks when faced with health emergencies, in order to allow all countries not to grant or enforce the protection of certain elements of intellectual property during the pandemic until we have achieved generalized vaccination, which is what today, as we all know, is what we're living on this planet. The Council of Outbreaks of the World Trade Organization has debated this proposal with the support of scores of countries and hundreds of civil society organizations. However, some developed countries prevent their progress and they block it, arguing that existing mechanisms of WTO, such as mandatory licenses, are working. However, Bolivia shows every day the failure of these mechanisms. Likewise, we should stress that the latest consequences have accentuated the need for arriving at a clear decision on the release of patents. The new variants are once again causing closing of borders, and we don't have any certainty of having a prompt soon solution. The issuance of voluntary or mandatory licenses in due course and on a timely basis. The negotiation for a temporary exemption of patents with the vaccines. The Plurinational State of Bolivia, when dealing with this, proposed to use the flexibilization of mandatory licenses. And on this specific, we should stress that in Article 31 and 31 bis of the APEX, we consider possibilities on the protection of patents. One of them is mandatory licenses that are authorizations granted by one government in order to authorize a patented granting without the consent of the incumbent of an owner of the patent. In Article 31 of the TRIPS, it allows us to issue this license, and therefore the person or the company requesting the license, first of all, has to negotiate in commercial terms a voluntary license with the owner of the patent paragraph B of Article 31. If this path has not led to a response, then we can issue a mandatory license. For that purpose, Bolivia began the process by signing an agreement in order to acquire 15 million vaccines in case of obtaining the mandatory license. Currently, Bolivia needs, in Canada, as a host country of the companies that provide and supply the vaccines, to notify the fact that this is a country before the WTO. The onset and emergence of new variants shows that while we are not all safe simultaneously and jointly, nobody will be safe. And therefore, we need to move forward with massive vaccination at a global scale, releasing patents and vaccines so that we will not have hoarding by the developed countries. Health cannot be a privilege or a good to be traded. As a Bolivia, we've done a lot on health matters. We will always insist in all fora in saying that one of the main places where we have to invest and where the economic resources have to focus is on preventive health. Therefore, aside from having a 30-30-30, as suggested by international organizations, Bolivia, on its part, will stress a much more preventive health, which is the cheapest and the one that will enable our countries to come out in a better position in having access to health. And with these elements, we would like to thank you for the time provided in this important event to be able to address all the ministers of health that are present here, and to thank you for your attention. Thank you very much.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. Distinguished participants of the Universal Health Day, the words of the constitutional president of the Plurinational State of Bolivia, Dr. Luis Arce Catacora, who is an economist, specialist in economic sciences from Warwick University in England, and Dr. Honoris Causa of the Universities of the Andes in France. Mayor. And in order to conclude our event, I wanted to invite now Dr. Jarbas Barbosa, who is the Assistant Director of APAHO. Dr. Barbosa, please. Thank you. Thank you very much, James, and good afternoon. Distinguished participants, first of all, please allow me to express our gratitude to our director, Dr. Carissa Etienne, for her leadership, especially in recent times, characterized by innumerable challenges to global public health, and especially for our region. I would also like to thank the participation of His Excellency, the President of the Plurinational State of Bolivia, Luis Alberto Arce Catacora, for his leadership at the national level in combating the pandemic. I believe that your participation, Mr. President, in this event is another example of your personal commitment and that of your government to universal health. Mr. President, thank you also for stressing the need for equitable access to vaccines and to other technologies as a key aspect in order to respond to public health crises such as this pandemic. The Pan American Health Organization has been working significantly with countries in the region in order to draw the attention to the vulnerability that we're exposed to in Latin America and the Caribbean, because the production of vaccines and the production of teams of personal protection equipment, the production of medicines is highly concentrated in some developed countries. We have to work together and comply with the mandate that was given to us by our member states in order to change this situation so that Latin America and the Caribbean will be in positions of equitable access and will be able to give a better response to future health emergencies. I'm also grateful to the Minister of Health for his participation in this event. Having spent over a year and a half since the beginning of the pandemic, the regional scenario shows that the health crisis has not been controlled, and that the feasibility of moving forward towards a recovery transformative situation is difficult in these circumstances. The pandemic has brought to light the need for building a public health agenda with a comprehensive and integrated approach that will acknowledge the interdependence that exists between the health, social, economic, and environmental dimensions, and that will deal with the social determinants of health in order to reduce inequalities. Our health systems ought to be transformed, taking into account the centrality of primary health care, as has been stressed by the president, equity in health, sustainability, and the role of the state. An agenda in order to strengthen the response to the pandemic calls for a strategy of greater public participation in health that will include the short and medium-term priorities in order to ensure financial sustainability of an agenda in order to strengthen the institutional capacities of the state. Our countries ought to step up health expenditures and investment, particularly the public side of it, in order to take care of the new needs that emerged with the pandemic, and that will also strengthen the provision of other health essential services. Unfortunately, the pandemic has reaffirmed what we've been saying for years. We need to deal with the weaknesses of health systems of most of our member states that is reflected in insufficient investment that are translated in turn into a critical shortage of human resources, technological resources, equipment, infrastructure, etc. And different indicators show this scarcity, but for years we've known about this. We ought to establish and set the basis for a transformation in the health sector, concentrating on primary health care that will respond to the specific needs as well as differentiated needs of people, increasing expenditure in public health, consolidating its financial sustainability, and prioritizing the allocation of resources to the first level of care. Besides, it is essential to continue with the efforts in order to reduce the gaps in equitable access to health with financial protection, finding support in as much as possible with funds for the health sector. We must also strengthen the governance of health systems by improving management and the coordination in order to make the best of the capacity of all the subsystems and sectors, public and private subsectors. And for that, it is necessary to increase the managing activity of the health networks. It is essential to advance on an agenda of institutional strengthening of the state in order to guarantee the right to health of the population. This implies strengthening the capacities of the authorities, the health authorities, at their different institutional levels and in conjunction with other institutional sectors as well as social actors. In this sense, it is necessary to have the competencies of the structures and agencies of the state responsible for exercising essential public health functions, as well as those that could add value to digital health interventions equipped with a trained, skilled human resources with adequate infrastructure and technological support, and also adequate and sustainable financing. These capacities must be complemented by accountability mechanisms that legitimize greater and stronger interaction between civil society and state functions. Finally, I would like us to think about the future of our region with respect to the right to health of our populations, beyond the necessary action on the determinants of health that are outside our health systems. It is necessary to ponder upon what it means to invest in health systems for everyone in each context. Leaving no one's health behind implies an inescapable effort by our member states to equip our health systems with the resources, human, financial, necessary resources in order to ensure universal access to health everywhere. And a fundamental part of this effort must be financed with public resources so that the slogan, "Leave no one's health behind, invest in health systems for all," does not remain only as a slogan. There is ample evidence that the natural alternative to public financing in health is spending at the time of care, that is to say, out-of-pocket spending. I believe that all participants here present agree in saying that we do not want a society where access to necessary health services is determined by households' ability to pay. And for this, in order to overcome this one and many other barriers and hurdles that make it impossible for many people in Latin America and the Caribbean and not to allow them to have access that is needed to health systems, it is essential to step up efforts in order to progressively increase investment in our health systems. And in this undertaking, member states have the full support of the Pan American Health Organization. Thank you very much. Thank you very much, Dr. Barbosa. Distinguished colleagues, ministers, participants in this celebration. With these final words of Dr. Barbosa, we've come to the end of our event today. We thank each and every one of you for your participation today, this Universal Health Day 2021. Leave no one's health behind to invest in health systems for all. Thank you very much.